Well, I'm O.P. Yadav. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. Very standard nowadays, a second time bypass is becoming virtually a day-to-day affair because most of the patients who operated in late 60s and 70s were done with veins, and they are all now presenting back for a second time surgery. To the best of my knowledge, published literature is there of small series of third time and fourth time bypass also. Therefore, bypass surgery can be performed multiple number of times, but as you go higher in the numbers, the risks do definitely multiply.